So now we have finished about diet. Now let's just go into physical activity. There are a lot of prospective cohort studies and randomized control studies done, and they report an inverse relationship between physical activity, increased physical activity that will cause less risk of type 2 diabetes, almost reporting 25 to 40% reduction in the relative risk of diabetes when you are doing that. And also it indicates sedentary behavior increases the risk of type 2 diabetes. Nowadays, the population, you can find out a lot of people having, of course, the work behavior, the type of work which you do is mostly not, it's mostly like sedentary, like we are sitting, even as a healthcare professional, we are not moving around, and we are just, everything is documented by sitting in the computer, and that actually causes a problem of, we can say, as sedentary or sitting is another problem which is raising up. Sitting for too long, it is almost equivalent to smoking risk actually. So when you talk about physical activity, I mentioned already 30 minutes per day or 150 minutes per week of moderate to vigorous activity. It can be any kind of physical activity. It should not be like, you have to base it on any individual's choice actually. You should not force them that you should do a vigorous workout like aerobics or swimming, like that. Whichever, it's all patient centered, and they have to choose whichever is suitable for them. Walking, occupational activity, leisure activity, or resistance exercise. But if you do it everything as a mixture, sometimes you will get benefit from the muscle mass and strength and calorie burning. And movement and physical activity, other studies have mentioned that 30 minutes of daily moderate activity is very, very beneficial. And aerobic exercise over many weeks was a primary variable studied, which leads to a lot of benefits. And nowadays, yoga meditation is an effective type of movement activity for improving weight and also mental well-being. The mental fitness is also important. Of course, I used to say that obesity is mainly related to mental fitness. So for you to maintain that mentally, if you are fit, you need to adopt and follow this yoga meditation. It's very, very useful. Other lifestyle habits, I have to tell you, good sleep is very, very under recognized, or not much of awareness about this increased or good quality sleep, I can say, or a good adequate sleep duration. And next one is psychosocial stress. Everything is centered around the psychosocial stress, and not the least is smoking and alcohol, increased alcohol intake, I should say. So when you go into the sleep duration, there is a survey which is done that involved 54,000 US adults who are more than 45 years old. They were found sleeping too little. And another group of patients, they were sleeping too much. Both of them is not advisable. Sleeping too little and sleeping too long were associated with obesity and later on with type 2 DM. So sleep duration is very, very important. And it was noted that it can cause increased risk of type 2 diabetes. And short sleep duration is independently associated with weight gain. So obesity and sleep deprivation. So if you have, there is one, the hormonal studies also show that ghrelin, cortisol, insulin, hunger, they are all increased when you are having deprived sleep. When you are waking up, when you are totally awake in the night time, these hormones are released, and that will causes more of hunger pain. And reduced leptin levels. This is another hormone which is associated with satiety. So leptin is a hormone. When you are awake or when you work for longer hours, you tend to have reduced leptin. And sometimes you won't recognize these fat cells will not release this when you're working. So they tend to get decreased, and that will cause more reduced satiety, and you will tend to eat more and more. So that will cause obesity due to sleep deprivation. Psychosocial stress and BMI. The amount of weight someone gains when exposed to stress depends on the intensity and duration and the type of food available also. So when you are stressed, whatever the food which you are seeing, definitely it's going to get impact, show you the impact on your glycemic level and obesity. So this is the factors. This slide shows all the factors which causes increased psychosocial stress, like chronic health issues. Definitely they will become stressful. Changes in routine, lack of access to healthcare, economic challenges, inadequate social support, abusive relationship, and difficult decisions, depression. They all contribute to the psychosocial stress, and it's a life cycle. I mean, it's a cycle of chain. I can say chain, where one affects other, and that will cause overeating, and that will cause more prone for obesity and diabetes. And once they are diabetic, then they have become, it's a visible problem to others, whereas hypertension is not visible. But obesity is a visible problem that becomes a social stigma, and they become more depressed, and they overeat, and they tend to put on more weight. And it's a vicious cycle, we can say. So which should not be, so mental well-being is very, very important. That's the main thing which I wanted to stress here. Increase cortisol levels. Of course, when you're stressed, the cortisol level increases, and it's very, very important to do the counseling and screen for emotional stress with the patients. And there are a lot of stress reduction programs. There are patient well-being groups, and through WhatsApps and many other platforms, they have to join, and then they get a lot of advices. And controlling the response to stress is also very, very important. It can positively influence on our health. And cultivating supportive relationships is also very, very important. Talking with friends and family, it will help us to modify our behavior, and it can impact weight loss program. So persons of the same sex have a greater influence. Like if they have boyfriends, their mindset will be same, or the girls groups, they will have a same mindset, and they will try to support each other. And social networks also will have a greater positive influence. And the take-home message here is the prudent in diet. The diet is the main thing. You need to concentrate on the food intake based on the glycemic index value. Healthify Me app is there. It's one of the app which I wanted to tell you. There are many other apps. Plan your diet very well ahead. You need to just change the quantity of the food. Or many people studies, they don't recommend, don't eat that. What they are all recommending is concentrate on the portion size, alter the quantity of food. Rather than the quantity, you should also look at the quality of the food, which I told you, low glycemic index foods. And if it is moderate glycemic index food, you reduce the quantity. Whereas low glycemic index food, you can increase the quantity and eat the portion size, or the plate size. You can increase that, like vegetables and fruits, that can be increased. Whereas carbohydrates and proteins, carbohydrates should be reduced. And regular exercise, starting exercise program is not a big thing, but consistency is the main thing. Target every day. What is the target? You should know 30 minutes per day and 150 minutes per week, and gradually increase. And once you achieve 5% of weight loss, then try to maintain that. Don't put rebound, don't lead to a rebound weight gain. That's very, very important. And good sleep habits, and later on cessation of smoking, and reduce the alcohol consumption. And of course, overall, not least, low stress levels. That's also very, very important. You need to look at your mind or mental well-being. That is a take-home message. And thank you very much for joining us for this session. I think I have covered most of the points in the diet and lifestyle modification with regards to obesity and diabetes. Thank you very much. Thank you.
Thank you, Dr. Suresh, for a fantastic presentation. And immediately I'll be thinking in terms of people who can remember a subject called non-detail and a book, but this sounds to be a detailed presentation of each and everything. Thank you, Dr. Suresh.